The Balm in Gilead has been doing work of bringing the faith community and public health together for over 30 years. It was a small little idea started by our founder and CEO, Dr. Pernessa Seal, really to raise awareness about HIV. She was working at Harlem Hospital at the time, and she was literally seeing families come in, drop their loved ones off, and they were dead within a week. And so she wanted to think, what can I do to help, to do something? So she was like, let's pray. So she created a flyer. She went and knocked on the doors of churches in Harlem and asked them simply to join her in praying for the healing of AIDS. 30 years later, the Balm in Gilead is a national nonprofit that continues to now not just ask individuals and churches to come together to pray for the healing of diseases and health disparities that are impacting African Americans, but now to do something. How are we going to take action? What is it that our churches should do? Most of us in here, like on Sunday, we'll all be in here for the gospel show, right? So it's no different when we go home. We spend a great deal of time in our churches, all day on Sunday, back again on Wednesday, sometime again Thursday, maybe on Saturday for choir rehearsal. So we spend a lot of time in this space. So the Balm in Gilead works to try and put information like this in the church so that you can get it, so that you're aware, so that you know. And it was a part of this that we created our National Brain Health Center for African Americans. And I'm going to bring to the stage now Dr. Jonathan Jackson. He is with the Massachusetts General Hospital in Boston. Yes, he is a researcher. He is one of the smartest and most passionate individuals that I know in the space of brain health and Alzheimer's. And then I also want to bring to the stage somebody who I feel is like a sister to me, is Ms. Tina Thomas. She is the director for the Alzheimer's Association chapter in Richmond, Virginia, which is where the Balm in Gilead is located. So please join me in welcoming them to the stage.
All right. Thanks for having us.
Yes, thank you guys for joining us. So we're kind of going to transition now. We've been talking about diabetes. We've been talking about things that we need to do in terms of being more active, nutrition and things like that. What a lot of individuals don't know is the same things that we do to help prevent diabetes, high blood pressure, heart disease. Those are the same things that we need to do to help keep our brains healthy and functioning. And without your brain, I don't know about you, but there's not much we're going to be able to do if our brain is not functioning the way that we need it to. And so I'm happy to have Dr. Jackson and Tina here with us to talk a little bit about brain health, how we're going to keep things healthy. But one of the things I want to ask Dr. Jackson about first, so we've been hearing, or we hear a lot perhaps, about brain health equity. So is that the same thing as me saying is that the same thing as equality or equity? Are those two the same thing, or are they different things?
Well, just the basic terms, equity and equality are different things. So equality is giving everybody here $20. Equity would be recognizing that some people need $40, some people need 40 cents, some people need $40,000, and recognizing that we need to get everybody to the same level, and sometimes you need different amounts of effort to get people to the same level. So when it comes to talking about brain health equity, it's recognizing that when it comes to talking about brain health, all the things that you've heard on the news, all the things that we're going to be telling you today are based on science and data that did not include us. So when we talk about your risk factors, when we talk about the solutions, when we talk about our march to the cure for dementia, we are not at that table. And that is an inequity. We are being denied our basic right to health and wellness. And I've established a research center at Mass General and Harvard Medical School to try to take this on. And we're going to be talking to you a little bit today about how to make brain health equity a part of your everyday lives.
Thank you. And that is so important because I think, as you mentioned, we have to be at the table. You know, too often we're missing. If we think about now the medications that our loved ones take, or like the medications we were talking about, diabetes, we were not a part of those clinical trials that tested those medications. So when we look around and we wonder why our loved one isn't responding to that medication, the side effects are more significant in our family members, it's because, just as Dr. Jackson said, we were not at the table. We were not in the studies. And that's something we have to make sure. Because Alzheimer's and dementia, there is no cure. This is not something that I can cure or really, in essence, prevent. You can reduce your risk, but you cannot prevent it. And so it's so important that, yes, as researchers and as pharmaceutical companies are truly marching towards a cure, we got to make sure that the cure will work on our loved ones. So can you tell us a little bit, Dr. Jackson, about your work and the research and things?
Sure, but first I wanted to back up. So how many people know the difference between Alzheimer's and dementia? Okay, so there are some hands, but not enough hands. So what I'm going to do, and this is a power that has been given to me, I'm going to turn everyone into this room into a neuroscientist, just like me, all right? So we're going to do it in about 2 minutes, all right? So is everybody ready to become a neuroscientist? Okay, all right, so here we go. The difference between Alzheimer's and dementia is that Alzheimer's is a problem of the brain, dementia is a problem of the mind, okay? So when we talk about Alzheimer's disease, we are talking about physical changes in your brain. The buildup of two plaques, amyloid and tau, they build up in your brain. They cause some problems in terms of how your brain will function. When we talk about Alzheimer's disease, we're not talking about getting lost. We're not talking about forgetting your nephew's name. We're not talking about, putting your keys in the microwave. All of those are signs of dementia. When there's something wrong with your mind, when you have thinking and memory problems that interfere with everyday life. So when I say dementia, I'm not saying you come into a room and you can't remember why you're there. I'm not saying you've misplaced your keys. What I'm saying when it comes to dementia, it has to interfere with your everyday life. You've been living in the same house for 20 years. You forget how to drive home when you're like 2 blocks from the house. Now that's a concerning sign. So Alzheimer's disease is when things are going wrong in your brain, the buildup of amyloid and tau that leads to the destruction of brain cells, also called neurons. That's Alzheimer's disease. Dementia is a symptom of Alzheimer's disease, but there are lots and lots of other things that can cause dementia. So I'm sure everybody's heard of somebody who's had normal pressure hydrocephalus, who has had maybe some dementia at the later stages of diabetes, somebody who has maybe had a problem with alcohol and starts having thinking and memory problems. All of those can lead to dementia. The leading cause of dementia for older adults, that's adults over the age of 65, is Alzheimer's disease. So Alzheimer's disease can lead to dementia, but there are lots of other causes of dementia, all right? How are we feeling about that? Okay, is everybody a neuroscientist now?
You can go home and say, I came to Tom Joyner and I left, I am a neuroscientist
You're a
now,
neuroscientist, okay? I said so.
Great. So so Dr. Jackson, and thank you so much for explaining the difference between the two. So Ms. Tina, so if I'm a family member, and like most of us, sometimes we have family members that we start to see some signs, and unfortunately some of us just assume, hey, grandma's just getting old and she's senile, right? So can you share with us though, what are those signs that we should know and be on the lookout for?
Thank you, Pam. How many of you in the room know someone who is living with dementia or Alzheimer's disease, or you knew someone who had the disease before? How many of you have ever been a caregiver for someone who's had dementia before? Wow, that's a lot of experience in the room. And one of the things that happens for folks that are older adults, you'll start to get concerned when you're around 50, when you start to forget things. Is that Alzheimer's disease? Is that dementia? Am I getting it? I hear this every day. And some people say, is it old timers? What's happening to me? There are some things that are what we call normal parts of aging. There are some things that are going to happen just because of the aging process. And you will start to notice those changes in our 40s. How many of you are in here are at least 40? 40 and fine, 40. At least 40. When you turn 40, there's some changes that starts to happen in your brain that causes forgetfulness. That will happen to all of us. That is different than the dementia that Dr. Jackson was talking about. Dementia starts to impact how you care for yourself every day, how to clean a meal, how to brush your teeth, how to comb your hair. The person who truly has dementia is not just that they're having memory problems, because I think most of us can identify that somebody's having forgetfulness. It's the forgetfulness and your ability to function. How is she functioning? Can she drive? Can she make a meal? Is she more angry than she had ever been before? There are a lot of different things you want to be looking for, not just memory alone. So forgetfulness may be one, but how the person is functioning is another. Are they paying the bills? Is the food spoiled? Will they change their clothes? Is she very angry, irritated, frustrated? Is she able to take care of her medications? Those are all the things that you want to take to the doctor. Those are red flags. Those are signs to be concerned about.
Thank you so much. Because, you know, if I think oftentimes, and we all in here may know the scripture, you know, we perish for the lack of knowledge, right? So that's why we want to have opportunities to be able to get the education that we need about what are the things that we need to be looking for in our loved ones. What are the things that we need to be looking for and mindful, again, of ourselves. Caregiving and that burden of being a caregiver is also presenting major challenges when we talk about Alzheimer's and other cognitive or brain health issues. And so to bring us a little bit back, because I know some of your research lends into that, Dr. Jackson, can you tell us a little bit about the work there at Mass General that you've been doing and at your research center?
Yes. So I lead a small research center that's called the Community Access Recruitment and Engagement Research Center. It's a mouthful, so we call it CARE. It's the CARE Research Center. And the research center is really designed to make sure that research opportunities are more equitable, that they are more accessible, and that they are socially just. So, I mean, how many of you have heard about the Tuskegee syphilis study? All right. How many of you have heard about Henrietta Lacks? Okay, now I got a deep cut for you. How many of you have heard of a man called Vertus Hardeman? How many of you have heard of what happened at Lyle Station, Indiana? Columbia University in 1997. How many of you have heard of Eb Cade? How many of you have heard of Charles Sanger? All of these were abuses against the black community who were unjustly targeted for medical research over the last 100 years and change. The Tuskegee syphilis study was the most well-known, and it has led to the most changes in how we do research, but there are a lot of other stories. So I'm gonna be here. I'll be over at the Balm and Gilead booth, and if you wanna hear some of these stories, I will tell them to you. But what we ended up with is a system that will never allow anything like Tuskegee to happen again, but the solution was, we're gonna cut brown folks out entirely from research. We are not going to include them at all because we don't know how to design a research study that caters to their needs. So my research center is one of the only ones in the country, there's maybe one other one, that is tackling this problem to make sure that we are included as medicine continues to be developed, because we're moving into this era where medicine is becoming more and more targeted and more precise, moving into what's called precision medicine. And right now, all the precision medicine research is being done on one type of person. And that person is wealthy, overeducated, white, usually a man, and lives on the coasts of the United States. So if you are not all 5 of those things at the same time, you are being left out of research, and we do not know how medicine works on you. So people are worried about being guinea pigs. Right now, the way the medical system works, you're guinea pigs when they give you that prescription. That's how we find out how that medicine works on you or someone who looks like you. So my research center is really focused and dedicated on making sure that our voices, our thoughts, our needs, and our bodies are included in the process from day 1 to make sure that medicine works for all of us.
Thank you so much. So again, I have the pleasure of getting to speak and see Dr. Jackson and his work. And it is astounding, I think, to see the fact that, yes, we have just years and years, it's study after study after study after study after study with all these promising treatments and promising prevention efforts and promising programs and promising tools. But yet when you look into the data, when you look into the demographic of the individuals that were a part of that study, just as you said, we're not there. And so it is so important for work and for centers like Dr. Jackson, and for us to be able to connect and engage. Like, how many of us knew that there was a center that was dedicated and was looking to include us in that research? Absolutely. So we have to make sure that we're finding out where do I go? And it's important, you know, it's funny, you know, when Dr. Seal first met Dr. Jackson, and it was like, wow, he's black, and he's a researcher, and he's a neuroscientist. They would have us to believe that we don't have anybody in the research space who gets us and understands
There's
us.
like 4 of us. There's like 4, and I'm one of the 4. Yeah, we're a rare breed, but there needs to be more of us. So talk to your young black men. You know, if that basketball career doesn't work out, you know, if they don't get to, you know, start up their own business, tell them to look into research, tell them to look into science. The prospects are good. You get to make a difference. You get to be your own boss. It's not a bad life.
Good. Keep that in mind for my daughter to be like, girl, that didn't work out. Let's go do some research. So one of the other issues, so in addition to the more equity or the increase in equity that we need in our clinical trials, one of the other aspects of it that, Tina, that I would love to have you talk about is for those of us who have loved ones who are already dealing with Alzheimer's or some type of cognitive health where we're having to provide care, they may need treatments. What options and resources are available through the Alzheimer's Association, but then also we're talking about a population that's 65 plus or so that's also our Medicaid population. So what is available, what tools or resources that are available to help those families and those caregivers with those specific issues?
So one of the things that folks really want to become aware of as it relates to caregiving, the number one thing that surprises people is that Medicare does not pay for Alzheimer's disease or dementia care and support. People think, well, I've got good insurance. I've got Medicare. I've worked my whole life. I'm not worried about it. This is a care that Medicare doesn't pay for. Now, if you fall and break your hip and you have Alzheimer's, yes, they'll pay to repair your hip, but they don't pay for Alzheimer's care specifically because it's what's called custodial care. Medicare pays for things they can treat and make better. And because we don't have a treatment, we don't have a cure for this disease, it doesn't pay for that. So that's something that you want to think about. And the reason it's important is because you want to start thinking about planning. If you plan on getting older, the likelihood for you to bump into Alzheimer's disease or some type of dementia when we don't have a cure is very high. There are over 5.8 million people living with Alzheimer's disease. African Americans are the greatest at risk for developing the disorder. And if there were 100 people in this room, 50 of them would have the disease. Of the 50 who have the disease, only 25 of them were told that they have the disease. That means that there are people in this room and in our families who are living with the disease. We have the symptoms. We're going to the doctor. We're talking to the doctor about it, and it's in the chart. But the doctor did not have the conversation with you. So what we want to do at the Alzheimer's Association and at the Balm and Gilead and at other health organizations is make sure you are empowered to be a good advocate as a caregiver and not let someone say to you, well, your mom is 85. Dementia is not a normal part of the aging process. If someone has problems with their memory, their thinking, their language, their mood, their judgment, it's the reason behind it. And so as a caregiver, the number one tool you need is information. You need to be informed. And then you need a team. So I appreciate the women that were talking about sisterhood. If you're going to be a caregiver for someone living with Alzheimer's, this is not a disease you can take on by yourself because people live for a long time and it's very expensive. Now, my staff and myself, we lost about 8 people, 8 caregivers last year. The person with dementia is still alive. The caregivers are going down because they're trying to take it on by themselves. And when people say to me, Tina, no one can take care of my husband like me, I say, you're right. No one can take care of my dad like me. I said, you're right, but they can take care of him. It may not be exactly the way you do it, but they can get it done. You really need support with this disease. So getting information and developing a team of people that you trust who can come in and offer you support. You will have to give up that control.
Thank you. One of the beautiful things that I love about the Alzheimer's Association, and definitely our relationship with Tina Thomas, is that the Alzheimer's Association has local chapters in most places. And they actually provide some amazing resources to the community. They're free of charge in most cases. So there's trainings, they have tools, you can go online. They have a 24/7 rain, snow, sleet or shine hotline that is staffed by social workers and trained individuals to be able to support you and your family when you're dealing with that diagnosis. So if it's a question about, well, how am I going to pay for this? If it's a question about, well, what do I do with mom? You know, now, is there a place to put her? Is there a place for me to get respite and some self-care that I need to be able to do it? Find out who your local Alzheimer's chapter representative is. You can go on their website at alz.org and put in your zip code and where you are, and it'll tell you which chapters are in your area and where you'll be able to find information about it. The Bonnie and Gilead, as a part of our National Brain Health Center and our work, we created a campaign that really ties together the work that Dr. Jackson does around research and clinical trials and what Tina mentioned about caregiving and just that education piece in a campaign we call Memory Sunday. And so Memory Sunday is the second Sunday in June every year, and we created two tools. We have our the Book of Alzheimer's, which is any and everything you want, or think you ever needed to know about, just as Dr. Jackson said, about Alzheimer's and dementia and what the two and the difference between the two. But what do you as a family member, what do you as a caregiver, what do you as a pastor, a minister, the counselor, you're the person that everybody comes to when they have a problem. It's tons and tons of resources. And then we added a toolkit that is your how-to. So now that I got all this good information, what are some things that I really can do? So can I create a care support group? Can I create that team that we all need? Can I pray? So there's a whole section on just liturgical resources that may be at a Bible study or after church on Sunday that you can talk to that helps individuals through Alzheimer's and dementia and brain health issues. You know, wear purple, so we have ribbons that you can wear to show your support because it is a very a challenging disease. We lost my grandfather to Alzheimer's. And I remember being the family member that was away from home, a part of those conversations about what were we going to do? Do we take the medication? Do we not take the medication? And so as we think about, Dr. Jackson's mentioned the equity and having, you know, us being in the space and at the table so that we can be a part of what's going to come out of that. What are or how are ways that we can not only be more informed, but actually more engaged in centers like yours or in research? How do we find out about what's happening with NIH and funding or things that may be available?
Yeah, so I wanted to just, if there's one thing that you remember from the words that I have, just remember this sentence. If you're not at the table, who knows how this ends? If you're not at the table, you're on the menu, okay? So when it comes to the research of Alzheimer's disease and dementia, when it comes to the research about diabetes, which we were talking about earlier, we need to make sure that we're at the table, because if we're not at the table, we're on the menu. When it comes to research, we're living in an era where every single research study is looking for brown faces. They aren't talking to anybody with brown faces before they do it, but they are required increasingly by the federal government, believe it or not, as well as local agencies are saying you need to have more diversity in your studies. So this is happening. So what that means is all of you in the audience, you have power. When it comes to research studies, you don't just need to be a participant, you need to be an investigator, you need to be a researcher like me, you need to be on something called an IRB, an institutional review board that reviews every single study before it's allowed to start, that says this is how a study needs to be designed, this is how you talk to folks in the community. You need to get involved and stay involved because that's how we're going to make sure that research works for us. You have power. People are looking for you in the scientific field right now. You do not need a degree. You do not need to know what research is. You don't need advanced training of any kind. You just need to be somebody with a body and a will and a commitment to your local community. There is lots and lots of information. The National Institute on Aging, NIA, as well as the National Institute on Minority Health and Health Disparities. These are two components of the NIH that are looking to fund research. This is not money that just goes to places like where I work. They are looking for community organizations to hand hundreds of thousands of dollars to, millions of dollars to solve this problem. So get involved. If you need help writing a research proposal, I'm going to give you my card. You will call me. I will help you write your analysis plan. I will help you get those dollars. I will help you support your community because we have to do this together.
Thank you so much. Yes, a round of applause to that because there is and again, because we're in this space and we know, it is so important for us to make sure that you know that is what's going on. Like by show of hands, who has heard of the Change Act? Nope, nobody. That is a piece of legislation that was passed by our Congress that is meant to help individuals and their families with the issues and challenges of caregiving. So it just goes to show if no one knew that they've passed legislation, so it's passed. So there was not an opportunity for you to go to your legislator and let them know that, hey, this is what's important to me. We have to learn to be our best advocates. And so we can't always rely and depend on someone else doing it for us. We can't rely and depend on other individuals to be our voice and speak and say what we need to say. And that's a major, major, major problem. So again, you have to figure out from beginning of this process to the end of this process, we need to be a part of those discussions. We need to be not only the discussions, but the decisions. And then knowing that, yes, as legislation is being, it's no different than if we think about social justice reform or criminal reform or immigration, in any reform that is required, same thing. We have to be at those tables and those discussions. Because of caregiving and the cost. So a lot of individuals, so if you're like me, I'm a sandwich generation caregiver. I have small kids. I have 5-year-old twins, a 17-year-old, and I am also the caregiver for my husband who has a traumatic brain injury and he has cognitive decline as a result of that. I'm caring for him and I'm caring for our children and somewhere in between all that trying to also care for myself. So if I had to take off from work, that's lost income coming into our house. And we know that because of that, there are over almost $18 billion in unpaid time for caregivers to take off that is not being compensated. Well, there's legislation now that allows for individuals, if you're caring for a loved one, to be able to get paid and compensated for that. So again, whether it's the pharmaceutical issues and challenges, hopefully if we can find a cure for this, we also need to be engaged with our policymakers and having them understand this is how this is impacting our community, this is how this is impacting our families, and I want you to know that when you go back up to the Hill, I need this to be on your mind and your plate to say, yes, we need more legislation that's going to help support caregivers. We need more legislation and more push to make sure that they continue to seek us out for these clinical studies and these research studies. And so before we open it up to questions, I did want to come back and ask Ms. Tina one more a question in terms of some of the efforts with Alzheimer's, and I know some of the efforts you guys have pushed for in terms of changes to either legislation, but it relates to how providers, so if you're seeing someone, how they're able to actually now bill so that individuals can now hopefully be able to get the care that they need.
Sure. So there are two things that are very important, especially for folks over the age of 65. Now, when you turn 65, you should every year be going in and having your annual wellness visit. How many of you have had that before? Your annual wellness visit. That's good. If you haven't and you're over the age of 65, you should be asking for your annual wellness visit. And for those of you that are under 65, you should be going every year to get your annual checkup. But how many of you in the room have had your annual cognitive screening, annual memory test? Yeah, this is what I see no matter where I go. When I ask people, if we're lucky, we'll have one person raise their hands. So Medicare has now passed legislation that says that your provider is paid extra money to offer you an annual memory screening. It should be done in his or her office. Now, there are a couple of people who can do it. It can be the doctor, nurse practitioner, certified midwife. So there are several people who can offer this screening, and yes, you do want it. Because people will say, Tina, I don't want to know. Yes, you want to know. Because as you go in to see your doctor from year to year, they can take a look at if there are any changes and start to figure out why that's happening. So two things you want to be doing: your annual wellness visit and your annual cognitive screening. If you say, I can't remember that word, I want to have my yearly memory test. And the doctor can do that. It takes about 45 minutes to be done. There's a series of questions that the provider will be asking. It does not cost you any extra money. This legislation has been in place since 2011. It's a part of the Affordable Care Act. And only 16% of doctors are doing it. So the problem is this. Doctors will say, if my patients had problems with their memory, they would tell me and I would test them. And patients are saying, if my doctor thought I had problems with my memories, then he would do something about it. We're trying to educate you to say, ask for it. It's an entitlement of yours. Your insurance covers it. And what you need to know is providers are not having this conversation with their patients. Your doctor's not talking to you about it. So we want you to talk to your doctor about it.
Thank you. And that couldn't be further from the truth. We spent the last 3 years actually doing this type of education, but with providers. So with healthcare providers saying, hey, you serve and you treat and you see African-American patients. Why are you not doing these screenings? And they do. They have, again, well, like Tina said, they didn't mention it to me, so I didn't want to bring it up. Well, maybe they did, but then how do I give them another diagnosis? And it's for something that we can't cure. But again, if you are empowered to do that, that helps move that provider along to say, okay, well, this is available, and let's get the testing that needs to be done, and to determine it. Because like Dr. Jackson mentioned earlier, it could be something else other than Alzheimer's that's causing the dementia. And it could be something that, hey, if you fix it and you correct it, you're good. Again, education, we cannot say, and I think preach it enough, of just how powerful it is for you to know and to be informed and to not be afraid to ask the questions. Providers don't know it all, and they definitely don't know what you won't tell them. So they can only go on what some labs and what you said. So you need to, again, be important, come in there educated, have your questions and write them down if you need to. So that way you don't get in there and in the rush of that visit, forget, write them down and make sure you don't leave without getting answers to the questions. If they don't have time, ask, can you schedule a follow-up visit and come back? Ask, can you speak to the nurse? As a nurse, I spent more time with the patients than our actual providers did. I spent more time doing education and counseling. So even if you get rushed out of that provider room, ask that nurse as she's doing your blood pressure. I also, let them know, I've been having this, problems where I'm concerned and I really want to talk to the doctor about this. And if they can't do, like I said, come back. And like Tina said, if you have health insurance or a Medicare, you're entitled to this. They owe you that. That's what they're there for. Make them work for it.
And if you have a doctor that won't listen to you, my recommendation is find another doctor. There are other doctors out there. Find another doctor.
So at this time, I am going to open it up. And so if you have questions for Dr. Jackson or Ms. Tina that you want to ask about their work that they've been doing about Alzheimer's, dementia, brain health, you can ask and just come and step to the mics now and we'll take those questions. So yes, ma'am.
Yes, I was in an Alzheimer's study for IU. I was in the Alzheimer's study for IU in Indianapolis. They didn't call me back last year, and I was in it for like 4 years. And I was wondering why they didn't call me back. You know, should I call them and ask them why am I no longer in their study?
So first of all, thank you for participating in a research study. You're a hero, and you're the reason why we're able to make any progress at all on this disease, especially in our community. So thank you for being a participant. The reason why you weren't called back is nothing to do with you. I'm sure what happened is the study probably ran out of funding, because usually funding is on a 5-year cycle, and you spend that first year getting the study up and running, and then you'll run it for 4 years, and if you can't get more money, usually from the federal government, then the study will close.
Well,
So it's worth calling them to find out what happened to the study, because we as researchers are really bad about ever telling you what happened when you participate in these studies, and they need to.
Well, I just saw, before I left home, they just got a big grant for Alzheimer's study, so I will call them when I
Yeah,
get
so
home.
definitely get back in touch with them. They should be
Thank
getting in touch with you, but go ahead and make that first move.
Hi, I just wanted to find out, I didn't catch the beginning of your talk or your panel there, but I don't know if you covered
Can you say it one more time?
I said I didn't catch the beginning of your panel, so hopefully you didn't say what I'm asking or cover it. But my question is Alzheimer's and dementia something that you can get ahead of, or is it just inevitable? You know, like, is there preventatives?
So what I heard was, is Alzheimer's or dementia something that you can get ahead of, or is it
can you
preventable?
prevent it?
So
are there
I'm
things that
gonna.
you can
I
do?
think Tina and I probably will both be able to answer this. But what I want to say is, as a scientist, everything that I'm about to tell you now, just want you to mentally add in white people in your head, because that's the only research that we have available for the most part. So right now we think that if you have 100 cases of dementia, there are lifestyle modifications, lifestyle changes that you can make to prevent about 30 of those cases. And the 3 things that you can potentially do, doesn't matter how old you are, doesn't matter when you're starting, doesn't matter what kind of background you're coming from. Number 1 is the same thing that we heard during the diabetes panel, is change your diet, change your exercise. With Alzheimer's disease and dementia in particular, there's something called the Mediterranean diet. How many have heard of the Mediterranean diet? Okay, it's one of those really popular diets. It has been, I don't like using this phrase, but it's true, scientifically proven to reduce your risk of Alzheimer's disease and dementia. There was a study published 4 years ago that followed hundreds of people. So half the people did the Mediterranean diet, and they were really strict about it. It cut their risk of Alzheimer's disease by 57%. And then the best part of that study is that there was also a group of people who were bad at the Mediterranean diet. So they couldn't follow it all the way. They had that red meat. They put some butter on their movie popcorn. They still cut their risk by about 34%. So diet and exercise, and again, it's a dose-response effect. If you're not doing any of that right now, just doing a little bit, moderating 1 meal a week is a way of reducing your risk. The second thing that you need to do is you need to remain active and engaged, cognitively and socially. You don't have to have a lot of friends, but if you have 1 or 2 good ones, stay in touch. And then, kind of challenge your mind, challenge your brain. Get involved with your local Alzheimer's Association chapter. If there's a senior center, there's a rec center, if there's a library. Stay active, stay involved in your community. Those are really, really good things to do. And then the third thing that if you really want to continue to lower your risk is to get involved in research. You don't need to be a participant, but there are lots and lots of drugs that we're testing now and lifestyle modifications that are designed to reduce your risk of developing Alzheimer's disease. So those are the three things that I would say: diet and exercise, cognitive and social stimulation, and getting involved in research. I don't know if you want to add anything, Tina.
No, one thing you want to do is, to your question, I mean, there is no way to get ahead of it to prevent it completely from happening because we don't have a curative mechanism in place right now. But what you do want to do is control the controllables. You can control diabetes, high blood pressure, stress, heart disease, heart issues. You want to control those things you can control, and often they can be controlled by the things we put in our mouths, the things we do with our bodies, and the things we do with our minds. You want to prevent a premature event. What's a premature event? A stroke, a heart attack. Because on the other side of those events, you will find the symptoms of dementia.
And then by cognitive is, you know, like keeping your brain active, doing things, you know, thinking and reading and just using your mind actively just to do things. You know, like when you retire, you don't do a lot of that. So just staying active by making yourself having to think and reason and all that stuff, will that help also to kind of prevent it?
Absolutely. Word games.
Yeah.
I love Sudokus.
Yeah.
So yeah, I think anything that again, it can keep your mind engaged and acting and those wheels spinning. And then as Dr. Jackson mentioned, I think socially, you don't have to go out and meet a whole bunch of people or feel like you got to be going all the time.
Yeah.
But you do want to be engaged in some type of way socially where you're connecting to people, because it really is, again, it's you know, it's physically what we're doing, but it's also mentally and even in some cases spiritually what you're taking in that's going to help reduce that risk for Alzheimer's or dementia.
I did want to say, so it can't just be crossword puzzles and Sudoku,
Yeah.
because otherwise you're going to be 85, you'll have a lot of dementia, but be really good at Sudoku. So it's got to be like a whole life engagement kind of a thing. So when you're trying to challenge your mind, it's got to be more than one thing. So, you know, learn a new language, you know, try to figure out how to do something, learn sign language, try to figure out how to talk to somebody from a different culture, learn how to prepare a different kind of cuisine or food. And do that in addition to crossword puzzles and Sudoku, to really kind of use up your mind energy. That's good.
Okay. Fine, thank you.
Brain is a muscle. I mean, think of it as a muscle. So if we want to stay strong, have, you know, the Michelle Obama arms and whatnot, we've got to work on those, right? We got to
Yeah.
do things that's going to get those arms nice and tight and all that good stuff. So same thing with your brain. That cognitive stimulation is the way that you exercise your brain.
Yes, sir.
Hello, how you doing? My name is Alex. I just want to talk to you about a couple of things that I'm dealing with. I'm the youngest of 9 kids, and my mother got sick, and I've been taking care of my mother since I was like 14, and she got sick back in New York, so I moved her here to Florida 8 years ago, and she has either dementia or Alzheimer's. The thing that bothers me, she hasn't really been diagnosed by a doctor per se. They just, by the things that she do, they want to say she has it. So they give her these pills and stuff like that. So one thing that I commend the lady speaking on how you need to get a team and get help. I was taking care of my mom by myself, and trust me, I agree with you when you say there's more caregivers dead and dementia people live on, because I was like going crazy taking care of her by myself. And we're trying to work at the same time. But then my minister came to me and said, you know, sometimes as black people, we don't want to get help. And you need to get some help. So that's when she got sick again, and they put her in rehab. Then he asked me, I want to put her in nurse home, which, you know, sometimes we say, no, we don't want to do that. But I wound up doing it, and it was probably like the best thing for me, because now she's been there like 7.5 years. She, you know, does the activities. So I tell people there's no such thing as a good nursing home. You just got to be there 100% for your parent. So my thing is that that's one of my issues. But the other issue is that how do I go about finding out if she has dementia or Alzheimer's? Because the doctors and stuff that come in, or the people come in, they just want to check her and then give her medicine. You know, they don't want to deal with the root of the problem. So when I'm in the meeting with them and I see what they're doing, I just completely cancel the meeting. You know, like one lady came in, she's told my mother does she know who the president is? And this is when Obama was the president. She said, well, I don't know who he is, but I know boy, I sure like the way he walk. He is a handsome guy. And she tried, the lady tried like she didn't know who she was talking about. I'm saying she knows what she's talking about. So that's us and cut this meeting. Okay, this is over with. We're not doing this no more. So she's trying to just give her pills. I'm like, and my mother's 95, you know, and she don't have diabetes, nothing like that there, but she has this dementia. So I'm trying to figure out how do I get help with her dementia and her Alzheimer's, because sometimes I'm sitting in the bed and I've learned to just like watch her, just sit with her and just be thankful for the time I had with her and just be patient with that, because sometimes she'd be like sitting there and she'd be reaching for stuff that's not there, you know, or she'd be talking to people that's not in the room, you know, and I just say to her, oh, Ma, they gone, you know, don't worry about it, I got them. And she said, oh, you sure? I said, yeah, they gone. And then she's done with it. Or she might be reaching for stuff and she say, grab that, because this, and I grab it and I say, it's over, it's gone, I got it. I threw it out. And then she's go to back being normal again. So I don't know if that's a sign of dementia or Alzheimer's. Like I say, she hasn't really been tested like she should.
Well, let me say kudos to you for acknowledging that you needed to get some extra help and support with caring for your mom. It's very important. It's a big step. It's a hard step, especially for men. You know, at this stage of the game where your mom is, really focus on spending time with her and making sure she feels loved, she feels supported, that she's still acknowledged as the person when you're there with her in her space in the room. So that it's very important. The person who has dementia, there are a lot of things they can still do. They can still hear, they can still feel, they can still smell. So you want to make sure that that she knows she's loved, cared for, and supported every step of the way of the journey. And I'll let Dr. Jackson talk to you about how she can go about getting a diagnosis. And let me just tell you this before he tells you what he's going to tell you. She may not get it. It may not happen. Or it may be in the chart already. So sometimes asking the provider very directly, does my mother have dementia? You may be surprised.
So if your mother has a primary care, like a regular doctor, first check with your regular doctor, and he or she might already have an answer for you. That said, most primary care doctors are not very good at kind of distinguishing the different kinds of dementia. So you might ask for a referral to a specialist, either a neurologist or a neuropsychologist. So a neuropsychologist is probably the best bet. You can bring them in for about 2 or 3 hours of paper and pencil testing, and at the end of that visit, the neuropsychologist will say, you know, your mother has dementia and it seems consistent with frontotemporal disease or Pick's disease or Alzheimer's disease or normal pressure hydrocephalus or one of a, you know, maybe a few dozen different causes. And what that doctor will also be able to tell you is the trajectory that you can potentially expect for your mother in terms of changes to her behavior and her mood and her thinking over the next few years. So you would probably see that neurologist or neuropsychologist every 6 months to every year, depending on where your mother is. And that person can probably give you a lot more detail about what to expect as well as how to plan. And so I would recommend making that person or those people part of your care team along with your local chapter of the Alzheimer's Association in order to make sure that the caregivers, those who are providing support, get support themselves.
And I just don't be discouraged because of her age and where she lives,
Right.
that you may get pushback on that from them. So don't be discouraged. And I heard you talk about several folks in the family. As far as we know, based on the data that we have, the percentage from a genetic connector perspective is low. So I know people are always worried about genetics. The genetic connector, based on the data that we have, is a very low percentage. Less than 5% of people who have the disease has that doministic genetic connector. All right. And we're happy to answer any other questions you have about this over at the booth.
Yeah, we'll be at the booth, so come and see us.
Okay, perfect.
Yeah, we still have time.
Sure.
Thank you all so much for all the information.
We can't quite hear you, sorry.
Okay, is that better?
Yes.
Okay. I was saying thank you all so much for all of the information that you're giving to us. But my question is, my father has 7 siblings, with himself included, there were 8 of them, and at least half of them had Alzheimer's. And I was just wondering, is there a hereditary factor involved with Alzheimer's or dementia, or either one?
So that's a great question. Usually, the most cases of Alzheimer's disease are what we call sporadic, where there may be some small genetic influence, but not a big genetic influence. If there is a family situation where about half of the siblings or half of the people have Alzheimer's disease or some kind of dementia, that strongly suggests a major genetic risk factor. Because usually when it comes to genetics, with some exceptions, in Alzheimer's, it's a 50-50 roll of the dice. If you have this genetic mutation, you may get it. If you don't, that you won't. There are other genes that are involved, but with the case that you're saying, and again, I can't be sure, it does sound like there's a strong genetic component in this instance. So you want to make sure that you consider genetic testing for your family, as well as some strong family and estate planning, just to make sure that these things are taken care of as quickly as possible and as soon as possible.
Yes. Okay. Thank you.
Thank you.
Thank you for taking my questions. I have so many questions. I will stop over there.
Can you speak up a little bit?
Thank you for taking one of my questions. I will stop at the booth, but she said that to control your stress. That's my question. How do you do that?
Did you say something about stress?
Yes.
So the symptoms of dementia, depression, and stress can look very similar in the early stages of the dementia process. I mean, if you lined them up in a row together across like this, you would say here's stress, depression, and dementia. And check, check, check. The difference is that stress can be managed. You can be taught how to manage stress. We can treat depression, but there is not a treatment mechanism in place for dementia. So you can be taught how to manage stress. It is a skill. Sometimes doing yoga, mindfulness, self-care is very difficult for some people. So that's where that team is so important, so that you have to schedule time for yourself, especially if you are a full-time caregiver, so that we can learn better how to manage stress and take better care of ourselves. If you come over to the booth, I'll give you some information, some websites and places where you can go to get information on how to better manage stress.
Thank you so much.
I will say that my first research publication, which was about 10 years ago, was on stress and Alzheimer's disease. And what we found, which was consistent with what others have found, is that people who are the most stressed are twice as likely to have Alzheimer's disease as those who are the least stressed. So, like Tina said, self-care is important. You can do mindfulness. I'm a big believer in mindfulness, mainly because of research that I've done that shows that it is a real thing. But if you can't get behind that focused breathing or that yoga, the way that I manage my stress is that I iron my clothes every week. I set aside 2 hours. I will iron my clothes. I will
You
iron
come
my...
over my house.
Jonathan is going to open a
That's
cleaning
right.
business.
I'm a neuroscientist / dry cleaner. But I take that time, and it's very meditative for me. So, it doesn't have to look like the traditional meditation practices, just something that you can kind of focus on, something that's very repetitive. Some people find, that, drying the dishes or, these things that you can do for about 20 or 30 minutes, they can be a form of meditation or a form of mindfulness. So just make sure you take that seriously, build that into your daily routine. You may not be able to afford like a yoga mat or a fancy yoga lesson, but make sure that there's something every day that you do that lets you kind of disengage from the world, the headlines, that cousin Pookie who just always drives you crazy.
That's my
whatever it is
problem.
that you can do.
That's my problem. I watch lots of news. That really stresses me
Yeah,
out.
it's funny that Dr. Jackson, you mentioned that. So as I mentioned earlier, so my husband, because of his traumatic brain injury and his cognitive decline, riding lawnmower is the thing that lets him completely disconnect from kind of what, the things that are stressing. And and I'm like, why is the lawnmower going? Like, he cut the grass 2 days ago. It hasn't grown that much. But it's a place that he can relax, he can recenter, get his blood pressure back down, because it's all those kind of physiological things of stress that is putting us at that increased risk for the Alzheimer's or dementia. So find that thing that helps you to kind of recenter, to refocus, and it's not a selfish thing for you to check out. Like, you have to give yourself permission to say, I'm not available. No, I can't do that. No, I'm not coming. No, y'all can't come over here. I turn my phone off. Don't text me. Don't call me. This is my time. 20 minutes, 30 minutes. Take it wherever you can get it. I get it 10 minutes in the bathroom in the morning when nobody's bothering me.
Thank you very much.
Thank you.
So we have time for one more question. Yes, ma'am.
Thank you all for being here. I have a family member who has Alzheimer's, and I'm wondering if there are environmental factors that play into dementia and Alzheimer's, because we grew up in a neighborhood that was heavily in a manufacturing environment.
So this is a really new area of research. They've only been publishing on this for maybe the last 5 to 10 years. And what we have found is that those neighborhoods that are located close to manufacturing plants, that are located close to highways, that are in these like very industrialized zones of the city, are at much higher risk for Alzheimer's disease and other kinds of dementias relative to anyone else. We do know that the vast majority of those neighborhoods in America are heavily Black and African American. So what we are finding out for the first time is that there are these strong environmental factors. Another major environmental factor is the quality of education that we had as children. It turns out that especially in a heavily urbanized environment that has lots of pollutants, if you have that and you go to a school that's not that great, it really, really increases your chances of Alzheimer's disease. And what's really unfortunate is that in many cases, you can live like a very, very privileged, very charmed life after that, and it will not impact that risk that was set almost in stone between birth and roughly age 15. So those are some of the environmental factors. We're learning a lot more about that. If I could recommend a researcher to check out, her name is Jennifer Manley. Professor Jennifer Manley at Columbia University is starting to research a lot of these factors about the way that we lived as in our early life and how that affects our risk of Alzheimer's disease.
Thank you guys so much for paying attention and joining us, and the questions were amazing. And again, if we think about, to kind of sum up a lot of the touch points that we've talked on, whether we're looking and talking about the clinical research, whether we're talking about caregiving, whether we're talking about just the education and the awareness, it all requires us to do, if one of the things public health likes to do is to create these buckets. So there's 3 buckets that we want you, when you to leave, to think about how you're going to engage. So the first bucket is that policy bucket. Policy bucket is a really, really big one because it does touch on those environmental things. If you're not participating in your local city council meetings, when they're looking at how they're going to rezone an area, they will rezone it and put that plant next to where you live or where your kids go to school. And again, you were not in the room. So policy is one of those buckets. Systems. So if we think about, again, healthcare system, our education system, we have to think about how are we engaging in these systems that impact the things that are putting us at risk. And then the environment. So that's where we live, where we work, where we play, pray, all of that. We have to think about those little small things. And am I doing something across all 3 of those factors that's going to help improve and reduce my risk for developing dementia, for Alzheimer's, diabetes, all the things that we've been talking about today. But it does require you to do something. And again, whether it's big or small, we hope that you'll leave here today and think about, what am I going to do when I leave Orlando? So when I go back home, how am I going to de-stress? How am I going to make time for myself? Am I going to go, hey, I got a doctor's appointment coming up in 2 weeks. I'm going to make sure that I ask them for my memory screening test that I know I'm supposed to have. And then, yes, I want to look and find out, are there research studies going on in my area? Or should there be? And who can I reach out to figure out to say, hey, we want to be a part of it, and we think our community would be great to participate in your study. So again, Dr. Jackson and Tina will be over at our booth. We also want to encourage you to definitely stop by there to pick up. We've got information, we've got resources. We have information at our website, thebombandgilead.org. You can download the Book of Alzheimer's or the Memory Sunday Toolkit that we've mentioned. We have information and resources from the Alzheimer's Association on the website as well. And if you have enjoyed this conversation, if you've enjoyed our talk about diabetes and food and nutrition, I highly, 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 highly encourage you to come with and be with us in Charlotte, November 19th through the 22nd for our 6th annual Healthy Churches 2020 National Conference. It is 3.5 days of praise, worship, dance, fitness, food, education. Dr. Jackson will be with us at Healthy Churches. Tina will be with us at Healthy Churches. And we really take the time during that conference to again, have this dialogue to provide you with the education and resources. Some of the drug makers that we mentioned that are making these drugs that we take are going to be at that conference. And they're going to have booths. It would be lovely for them to hear from you about how you want to engage and support them in whatever the next iteration of this new drug that they want to come out. So it really is a great time. There's information about the conference for you to sign up and know where to register. You can come as a group and save some money, but we're going to be right up 95 in Charlotte this year, and we really hope that you'll be able to come out and enjoy us. So thank you, everyone, for joining us. Enjoy the rest of the family reunion.
Thank you.
Thank you.